Hi guys, we're going to look at chapter 6, and this is going to talk about patient, subordinate, workplace, and professional advocacy. So we're really going to discuss a lot of advocacy as a leadership role. As nurses, we know we're going to have to advocate for our patients, but we also need to be mindful that we need to advocate for our care assistants and even our profession of nursing. So let's get started here. Simply put, advocacy is protecting and defending what one believes in for both themselves and others. The actions of an advocate are to inform others of their rights and to be sure they have adequate information on which to base their decisions. So by informing others of their rights, and giving them sufficient information, they can base decisions in an appropriate way. And this is really a very important leadership role. Nurses must advocate for themselves, for their clients, for the subordinates, and for their profession. So how do nurses act as advocates? They can help others make informed decisions, remembering giving the information, not giving them advice, so that they can make those decisions. Acting as intermediaries in the environment. So if the patient is concerned about talking to the doctor, maybe you could be the go-between. Directly intervening on behalf of others, and then advocating for social justice. Patient advocacy is necessary because disease may result in decreased independence, loss of freedom, and interference with the ability to make choices autonomously. In addition, physical, mental, or social disabilities could also put individuals more vulnerable, and they may need that advocacy from you. So we talked about managers advocating for patients and what that might look like. As we continue to look at advances in science with limits in financial resources, new problems and ethical dilemmas can be created. Some of the ethical problems that have been created due to strain on fiscal resources are patient dumping, premature patient discharges, and inequality of care. Some common areas that nurses must advocate for patients may include end-of-life decisions. We have an aging population, so we may have to help with some of those decisions, at least advocate for some of those decisions. Technology advances, right? Since the pandemic, our technology has skyrocketed, so we may need to advocate for our patients in that way. How about access to health care? Some patients don't even have the access. So how do we advocate so that they can find access? Transitions in healthcare. Let's say this is your hip replacement grandma who now has to transition from the hospital setting to a rehab. How can we advocate for her? Insurance authorizations, medical errors, several of them are listed there. So these are just some of the common areas that we may have to look at when we're advocating for our patients. So let's talk about patients' rights. Since 1960, some advocacy groups, professional associations, and states have passed bills of rights for patients. Although not legally binding, they can be used to guide professional practice. So the 1998 Patients' Bill of Rights is a statement of the patient's rights that are legally binding when they're backed by the law or state regulations. They are not legally binding when issued by healthcare organizations and professional associations. So what does that mean? Patients will reasonably expected to be treated during a hospital stay based on their rights. This is not legally binding, but professionally binding. So 3 key goals for this statement might include that patients feel comfortable in the system, stresses a strong patient-provider relationship, and then stresses those key roles patients play in staying healthy. In 2010, the Patient Protection and Affordable Care Act was added to establish patient protection when dealing with insurance companies. Other additions that have progressed patients' rights related to privacy are HIPAA and ARRA. There have been some legally binding legislation that has been passed to safeguard vulnerable populations. So Genetics Information Non-Discrimination Act is one of those binding legislations. The federal law passed in 2008, making it illegal for health insurers or employers to discriminate against individuals based on their genetic information. This law really has two parts. One part prohibits discrimination in health insurance, and the other prohibits genetic discrimination in the employment setting. Person and family-centered care. The philosophy of person and family-centered care suggests that care should be organized first and foremost around the needs of the patients and family members. This approach to care humanizes, personalizes, and demystifies the patient's experience. So the person and family-centered care supports the value of patient and family-centered care, asserting that it is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutual beneficial partnerships among healthcare providers, the patient, and the families. At times, individual rights must be superseded to ensure safety for everyone that's involved. So the National Right to Die movement has gained momentum in the past decade. Typically, right to die laws apply only to those patients that are at least 18 years of age with the capacity to make those medical decisions, with a terminal disease expected to result in death within 6 months. Patient choice is important because it's an expression that may lead to the discovery of other factors. It is important that nurses and nurse leaders appropriately differentiate between controlling your patient choices by displaying dominance and dependence, and in assisting patient choices by allowing patient freedom. Promotion of patient-centered care can help to ensure that we are not controlling patient choices, but we are assisting patients in making those choices and advocating for whatever decision they make. Subordinate advocacy is a situation in which managers assist subordinates to resolve problems and live with the solutions at the unit level. Nurse administrators should advocate for other healthcare providers, right? We've talked about that, including the subordinates, as well as the patients. Leaders can also advocate for subordinates by creating a work environment that promotes risk-taking and leadership. Workers then feel empowered to speak up for patients, themselves, and the profession. Workplace advocacy. This may include assuring OSHA standards are followed, so educating staff about proper body mechanics to decrease injury, or reducing exposure to workplace violence, needle sticks, or body fluids. Other advocacy roles by the manager will include reasonable work hour and schedule expectations. Wages will be fair and equitable, and nurses will participate in organizational decision making. Leaders also advocate for subordinates to create that work environment that promotes that risk-taking and leadership. So we know that wrongdoings do occur. They may occur in large corporations and political activity, but they can also occur within health organizations. Raising concerns at work, known as whistleblowing, is the act of reporting about a risk, a wrongdoing, or illegality at work in the interest of the public. There are two types of whistleblowing: internal whistleblowing and external whistleblowing. Internal occurs within the organization, reporting up the chain. External involves reporting outside of the organization, such as to the media or some elected official. Fraud, misrepresentation, and ethical maleficence are some prime examples of healthcare concerns. So although much of the public wants wrongdoing or corruption to be reported, such behavior is often looked upon with distrust, and whistleblowers are often considered disloyal and experience negative repercussions for those actions. It is a big step for many people to blow the whistle, and we know that staff who speak up can often feel very isolated and stressed. When a nurse sees a wrongdoing that needs to be reported, the nurse should carefully document any prior attempts to resolve the situation. It would really be unrealistic for the nurse to expect supervisors' support without that necessary documentation of the wrongdoing and what was done to resolve it. Advocating for professional nursing is a leadership role. Leader managers must be willing to advocate for those whistleblowers who do speak out about organizational practices that they believe may be harmful or inappropriate. Leader managers also must be advocates for the nursing profession. We've said that multiple times. When nurses find a discrepancy between their perceived role and society's expectations, they have a responsibility to advocate for the profession. So let's look a little bit at nursing advocacy role in legislation and public policy. As nurses, if we're thinking about writing a letter to a legislator, this can be the most influential thing that we can do. And we need to make sure that these are form letters. They need to be formal, but they need to be polite. So we need to make sure that we're addressing the legislator by title. We're establishing our credibility early in the letter as both a constituent and as a healthcare expert. We should state the reason for writing the letter and refer to a specific bill by number. So do the research, especially if you're passionate about this. Then state your position on the issue. Offer your assistance as a resource person for additional information. Sign the letter, including your name and your contact information. And be persistent. Write repeated letters to the legislators who are undecided on an issue. Well, there is a great sample letter in your book that you can look at when you choose to decide that if you want to write a letter. Nurses do have great potential to educate the public and influence policy through the media as a result of the public's high trust in nurses and because the public wants to hear about healthcare issues from a nursing perspective. Many nurses avoid media exposure because they believe they lack the expertise or because they lack self-confidence. And this is really unfortunate because both the media and the public place has a high trust in nurses, and they want to hear about those issues from their perspective. Nurses should take opportunities to appear in the media. This could be television, newspaper, and radio. The public needs and wants to hear from the nurses. So get some media training to increase both your skill and your self-confidence. These tips may be helpful for nurses in learning to navigate the media, respect and meet the reporter's deadlines, assume until proven otherwise that the reporter is going to be fair and accurate with their recordings. Have key facts and figures ready for the interview. Limit your key points to just 2 or 3. Right after about 3 of them, it gets boring. People tune out. They stop listening. So limit it to 2 or 3 key points. Avoid technical or academic jargon. Again, if we use really big words, people aren't going to understand and they're going to tune out. Speak confidently, but don't be afraid to say when you do not have the expertise to answer a question. It's okay to say, I don't know. I will get more information on that. Avoid being pulled in inflammatory arguments or blame setting. Go back to your key points if you get off on a tangent or you're pulled into a tangent. Provide the reporter with contact information to follow up and needed clarification. And then be prepared. Make sure you're ready before you approach the media. Provide the media with clear, concise information and stay on track by sticking to those predetermined points. And that concludes Chapter 6. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.